Good morning, everyone. This is Dana Parsons. Thank you so much for joining us today for the LeadingAge Virginia member coronavirus call. Just a few administrative updates before we get started. Wanted to remind everyone that we have a great opportunity tomorrow with the Executive Director of the Board of Long-Term Care Administrators, Corey Tillman Wolf. She is going to be providing an update for nursing home and assisted living administrators, including an overview of data and types of cases and complaints that the board has seen over the last year. I will also be providing an update on some of the key legislation that passed during this recent General Assembly session. And then we are going to end the session with a guest speaker by offering a few simple techniques to help you feel energized and allow you to catch your breath during the workday. This is offering one NABCE. So if you are interested in registering, we will put the link to registration in the chat box. Wanted to remind everyone about the LeadingAge Virginia Virtual Capitol Hill Lobby Day. That's a part of LeadingAge National's 100 Days of Advocacy. This is their plan that's aimed to reinforce the important role that our members play in state and federal advocacy. And because LeadingAge has decided to cancel the 2021 Leadership Summit due to COVID, this is where we usually visit the lawmakers on Capitol Hill. But now you're going to have a great opportunity for you and your residents to participate in the LeadingAge Virginia Capitol Hill Lobby Day virtually. So please save the date for that, and we'll be sending information out. We know that there are a lot of questions these days about residents resuming normal activities. There are so many questions, but we just don't have all the answers yet, and we're really starting that conversation today. So we're really pleased that we have two speakers today. Mike Magner from the Department of Health, who's going to be giving us an update about where we are on the vaccine, as well as talk about Virginia's vaccine bridge program. And then we're going to move over with Jody Agor with LeadingAge to talk about the new CDC guidance that has come out about loosening some restrictions to accommodate more visitation and so forth, not necessarily in the healthcare setting, but this is a first step. So with that said, I'd like to hand it over to Mike to give us an update. Thanks so much for joining us today.
Hey, good morning. Can you hear me okay?
We sure can.
Okay, so I want to give you a few updates on the vaccines, and then if Craig Damage is here, he can talk about the bridge strategy and the long-term strategy for linking long-term care facilities up with vaccines. If he wasn't able to make the call, then I can cover down on that. So first, I just want to mention the Johnson & Johnson vaccine. Just a little over a week ago, I know it seems like a lot longer than that. The Janssen vaccine received emergency use authorization and ACIP recommendation this past, it says this past weekend, but it was actually, I guess, 2 weekends ago. And it was authorized and recommended for adults age 18 years and older. It does fall under the same prioritization that the state is using for the other vaccines, the phase 1A, 1B, 1C, and phase 2 recommendations. The nice thing about the Johnson & Johnson vaccine is it's a single dose. It does use a viral vector platform to deliver genetic material to the human cell, so it's different from the messenger RNA platforms that were used in the Pfizer and Moderna vaccines, but it does still cause the cells to produce the SARS-CoV-2 spike protein on the surface of the cell, and it does generate a similar immune response based on how the cells respond to the vaccine. 2 million doses were allocated across the U.S. with 69,000 allocated to Virginia last week for delivery at the end of last week and early this week. Its effectiveness was shown to be 66% in terms of their global studies. It is important to remember that effectiveness estimates for vaccines cannot be compared head to head due to differences in study endpoints and the timing of when the study was done. So the Moderna Pfizer vaccine studies showing like 90 to 95% efficacy were done in the fall time frame when the virus spread was not quite as rampant and when there were fewer variants in the community. So that's why they say that we shouldn't be comparing these necessarily head to head because vaccines will have different efficacy rates depending on what's going on in the community with natural spread. Moving to the next slide, more on the Johnson & Johnson vaccine. So right now in Virginia, to try and just to assess really people's willingness to uptake the vaccine, we've been using it in the mass vaccination events where we kind of have like the large venues set up and we're doing thousands of vaccines a day. Again, it does have good efficacy because it's only a single dose regimen. It is nice for those events because getting those same people to come back in 4 weeks can be challenging. And there's a lot more flexibility with respect to storage and handling. So this is a refrigerator vaccine, basically, just like kind of what you're used to with the flu shot, where it can be stored in refrigerator temperature. And in fact, we'll go to the next slide and kind of go into sort of the technical aspects of it. And I'm sorry, not the next slide. I guess the next one's about Pfizer. But it is refrigerator stable, just like the flu vaccine, so we don't have to store it in the ultra cold. It doesn't have to be frozen, and it can last a lot longer. And again, it's only a one-dose series. But ultimately, our recommendation, when people say, what's the vaccine that's best for me? And our answer is whichever one is available first. So they're all pretty comparable in terms of efficacy. We think all three are great vaccines, and based on allocations and how much we're getting each week, we cannot necessarily guarantee that we'll have a specific version of the vaccine for a specific person on a specific day. But whatever vaccine's available, we recommend that people get it. I'm going to pause for questions before I move on to the Pfizer storage and handling update.
Mike, I don't.
Questions have come in yet, Mike.
Okay. All right. Well, I'll go ahead and move on. So the Pfizer vaccine, the FDA did announce that it's allowing for longer storage of the Pfizer vaccine at different temperatures. So previously, it had to be stored in the ultra low cold temperature until it was basically ready to be used within a few days. And so now, again, it does still need to be stored in the ultra low cold temperature for long-term storage, and it can be stored at that temperature all the way up until the expiration date. But now it can be stored at normal freezer temperatures, which is the minus 20 degree range, minus 20 Celsius for up to 2 weeks. And it can be stored in the refrigerator temperature for up to 5 days. And again, this is undiluted vials that have not been, pierced yet or thawed out yet for use. It can be stored at those temperatures for that duration of time. Again,
Mike, we can't hear you. We lost you. Okay, Mike's call ended. He's calling back in. Sorry for the technical difficulty there. Okay. While we're waiting for Mike to join us, if you have any questions, please put them in the chat box.
Hey, this is Mike. Can you hear me?
Yes, we can. And while a question or two came in, so whenever you're ready to take questions too.
Okay. Yeah, go ahead. Sorry, I think I was cut off in the middle of explaining the Pfizer vaccine storage. But
Yeah,
I
you
can go
were,
ahead and
you
go to the
were, Mike.
questions.
If you want to, the last word we heard from you was change. I don't know if that rings a bell.
Yeah, so this change won't affect how the vaccine is shipped. So they'll still ship it in the same ultra low cold storage containers with the dry ice. And it's still recommended that you try and store the vaccine at the lower temperature if it's going to be stored long term. But the 2-week time frame at the -20 should increase the number of sites that are able to store this vaccine for a couple of weeks while they're working on their plan to vaccinate. But yeah, I'll go ahead and jump to questions now.
Yeah, Mike, it won't surprise you. All the questions are really about the stuff that we've been talking about, in our smaller groups, which is aside from signing up for vaccinations through VDH, local pharmacy, will providers have the ability to obtain vaccines for staff administration? What is the plan for vaccinating new residents? And with the J&J vaccine, how will distribution to long-term care communities be made, and how soon will community staff be able to administer the vaccine? So kind of predictable questions that we've been talking about offline.
Yeah, and I think I'd like to defer those questions till we get through the slides on those topics, because I think the presentation will answer a lot of those questions. Specifically to the J&J vaccine, I'm not sure at what point that will be directly, shipped to long-term care communities. I know right now we've just gotten, we just started working with the allocations of Johnson & Johnson, and the initial state plan was to use those for mass vaccination events and not to target them towards specific populations, because we didn't really know how the public would react to the vaccine, if they would be comfortable with quote being targeted with a newer vaccine. So that's still to be determined. But let's go ahead and go to the next slide and talk about long-term care facility vaccinations in Virginia. So some data in here. Talk about the skilled nursing facilities. Walgreens and CVS have completed all first and second dose clinics. They are finishing up the third clinics, with the assisted living facilities, they've gotten through all of the first dose clinics, most of the second dose clinics, and are working on the third vaccination event clinics. And the third events are really just to catch up anybody who has not gotten their second dose. And again, they are administering first doses when they come out that third time if needed. So the next part is really, okay, what's next when this program winds down? And for some facilities are already past their third clinic. So what we're going to do, and we go to the next slide, we talk about the long-term care facility vaccine bridge program. There's really two strategies. One's the sort of the short term, and one's the longer term. And the mission for both is to support long-term care facilities for ongoing needs between the end of the CVS Walgreens arrangement and the inclusion of the COVID-19 vaccine in the normal pharmacy infrastructure. And if Craig Camage is on the line, if you want to jump in and take over, because I know this is really his presentation.
Yeah, sure. Confirm you can hear me?
Yes, we can.
Okay, perfect. Yeah, so thanks, Mike. The long-term care facility vaccine bridge program, as Mike noted, the mission here is to figure out how to continue to meet the needs of the long-term care facilities, both those that were met by CVS, Walgreens, and those that were met by other means from now until such time that 19 vaccine is folded into the normal pharmacy infrastructure and your normal pharmacy contracts are able to meet your needs. There's two broad strategies here. One is to get the job done and meet the need as best we can immediately. That's connecting vaccinators and vaccine supply to long-term care facilities in need. And then strategy two here is to work to fold that COVID-19 vaccine into the normal pharmacy infrastructure as quickly as possible. And I have some details on both of those strategies. So if we go to the next slide. Can we move to the next slide, please? Oh. There we go. So again, strategy one here is to meet this ongoing need. And in order to do that, number one, we need to understand the need. And the best way for us to understand the need is the previously distributed REDCap survey, where you can let us know about ongoing requirements for both Pfizer second doses that are needed based on first doses offered by another party, in most cases CVS and or Walgreens, and then your continued need for series start or people who haven't had any vaccine and need to begin the process. Maybe they are turnover staff or new admissions. We are working with the MHA Pharmacy Network that's working with 6 pharmacies within Virginia, long-term care pharmacies, to try to cover the entire Commonwealth to meet these needs. Again, right now, the best way for you to let us know about those needs is that REDCap survey that all the associations, including LeadingAge, have and have distributed. I'll be real honest, that's not an optimal tool. It's a survey tool, and we're trying to use it kind of for a separate purpose, but as it stands, it's the best we have. So do make sure that if you have ongoing needs, you've completed that survey. It's well understood that those needs will change on an almost day-to-day basis. If you have significant large-scale changes to your REDCap data, you can submit another form to let us know about those. If they are small changes, the way that you will be served is at some point over the coming week or two, these calls have already started to be made. Our pharmacy partners will reach out to the facility point of contact that was listed in the REDCap survey to confirm what your need is and schedule to come and meet that need. So if there are small changes to the need based on the REDCap data, you could just share those changes with the pharmacy when they call. We are working with, as I said, several partners. I can't say which of those pharmacy partners may reach out to you in particular, but that outreach began yesterday. We are prioritizing those Pfizer second dose requirements, particularly those that are past due. Everybody is still within the 42-day window that CDC allows, but as we will rapidly catch up on those Pfizer second dose needs and begin to start deploying pharmacists and vaccines to meet series start requirements as well. Now, while that's going on, if you'll go to the next slide, we need to also work through strategy 2, which is to get the COVID-19 vaccine built into the normal long-term care pharmacy infrastructure in Virginia. I am in conversations with a dozen long-term care pharmacies that long-term care facilities already have contracts with, and we are working through the process as to how we get those pharmacies enrolled as vaccine providers, and then which long-term care facilities themselves would be required to enroll as providers, and working through that process as well. Anybody who holds or owns this vaccine needs to be an enrolled provider. And while many of our long-term care facilities in Virginia have submitted the intent to provide vaccine form with VDH, they've not been prioritized by the VDH enrollment team until now, because there were other people that needed to be prioritized for enrollment. We have a meeting with the enrollment team this afternoon to begin to prioritize those long-term care pharmacies and the facilities. and we will be approaching a situation where if you are a long-term care facility that is served by a long-term care pharmacy, and it is typical for that long-term care pharmacy to deploy pharmacy staff into your facility to administer meds, we should be able to enroll that pharmacy, and they should be able to meet your ongoing needs after that enrollment is complete. If your situation with your long-term care pharmacy is one in which you receive medication delivery from your long-term care pharmacy and you utilize your clinical staff to administer those medications, in that case, both the long-term care pharmacy and the long-term care facility will need to be enrolled. And when we can get through that bottleneck and get that enrollment done, we will be able to start utilizing the normal pharmacy infrastructure to meet these ongoing needs. And that's everybody's goal. If I had to put a target on this, I mean, we're all working our tails off on it. My hope is that within 3 or 4 weeks, we have the lion's share, if not all of this enrollment complete. And again, the normal pharmacy infrastructure that you guys are used to using to meet your vaccine and other needs is able to care for ongoing needs going forward. There may be one final slide there. Nope, that's complete for mine. So thanks, Mike. I'll pass it back over to you.
Thanks, Craig. I think that's all we had to present this week. So I guess we can take any questions at this time.
There are no additional questions in the chat box unless those of you who submitted your vaccine questions need further clarification. And if you do, feel free to unmute and ask your question.
There was one question in the chat that came in at 10 after 11 that was with regard to vaccinating future staff. And that was covered in my remarks, but there's one additional detail I may add there. As the vaccine supply within Virginia and the access points for Virginians that are mobile increase, it's going to become easier and easier for staff to receive a vaccination through some other means. And I think that within a period of just a couple of weeks, we'll be in a situation where your new staff that you hire will find it reasonably easy to find a vaccine in the community at a community event or through the federal pharmacy partnership and a Kroger or a Food Lion pharmacy or what have you. That may end up being the easiest pathway for new staff. We will then be focused on new residents in the program that I was just mentioning, because it's obviously more difficult for them to seek a vaccine through another access point. So just that one extra detail.
Thanks, Craig. And I don't know if you saw in the chat, Tracy says she's going to leave you alone today as opposed to yesterday. I don't think she should, but she's looking out for you.
It's all good. You guys are important stakeholders, and I want to share as much information as I can. So thanks for the opportunity.
Great. Thanks so much. Dana, back to you.
Thanks, Melissa. Well, thank you, Mike and Craig. We hope you can continue to stay on as we move into talking about the CDC guidance, but we want to thank you again for the update today, and we'll continue to have this conversation with you and get clarification on any questions that our members have. So thanks again. So now we are going to talk about the CDC guidance, the interim public health recommendations for fully vaccinated people. Thank you so much, Jody, for joining us today. So over to you.
Hello, everybody. Oh, I sound terribly tiny. Hang on just one second. I can adjust it a little bit. Okay, maybe that's a little better.
Yeah, you sound great.
Okay, so yeah, CDC put out some new guidance early this week. They put it out on the 8th, and I see that the link is there in the chat. You guys are on it. So just a hint, this is called Public Health Recommendations for Fully Vaccinated People. And one of the things that we're learning as the new administration transitions in, there's like keywords in the language that they use that tells you your context clues. So when they say public health recommendations, they are referring to the public at large. If they're going to be talking specifically about nursing homes or assisted living, they're going to use words like healthcare setting or long-term care guidance. So anytime you see any new guidance coming up from CDC, you can kind of evaluate it in terms of those keywords that they're using. So as you're listening to this guidance, I want you to be listening with your general person out walking the streets hat on, rather than thinking of it in terms of nursing homes or assisted living or independent living or healthcare settings or even like healthcare personnel. So this new guidance says some things about the kinds of visitation that can occur for fully vaccinated people. And remember that fully vaccinated means 2 weeks have passed since the final vaccine in your series. So that's your second vaccine for Pfizer or Moderna and your single vaccine dose for the Johnson & Johnson vaccine. If you are fully vaccinated as a regular person, here's what you can do. You can visit with other fully vaccinated people indoors without wearing masks or physically distancing. You can visit with unvaccinated people who are all in the same household indoors without masks and social distancing, as long as the people you are visiting and the people within their household are all at low risk for severe COVID-19 disease. If any of them are at increased risk, even if it's not specifically the people you're visiting, but just someone who lives in the household, then you shouldn't be indoors without masks and physical distancing. But if everybody's safe, low risk, that's what you can do. You can also refrain from quarantine and testing following a known exposure, provided that you remain asymptomatic. And there's a star that goes along with that I'm a little asterisk that I'll cover at the end. But that's what you can do as a fully vaccinated individual. Next slide, please. Here's what you should continue to do. You should continue to wear masks and social distance anytime you're in public, anytime you're visiting with unvaccinated people who are at increased risk for severe COVID-19 illness, or of unvaccinated people in their household who are at increased risk, or when you're visiting with unvaccinated people from multiple households. Then you got to wear your masks, you got to social distance, and ideally those visits should take place outdoors or at least in a well-ventilated area. Fully vaccinated individuals should continue to avoid medium and large-sized in-person gatherings. You should continue to get tested if you're experiencing any symptoms that are consistent with COVID-19 illness. You should continue to follow guidance that's been issued by your individual employer. And you should continue to follow CDC and health department travel requirements and recommendations. And I'll go into that a little bit more as well. Next slide, please. So those special considerations, again, fully vaccinated 2 weeks after the final dose in your vaccination series. So if you are not vaccinated, obviously you don't get to follow this guidance, but if you've only had 1 dose in a 2-dose vaccine series, or if you are not out of that 2-week period, you are not considered fully vaccinated, and so you need to continue to follow all of the social distancing and masking. It's only at that 2 weeks has passed. Remember that, again, this guidance is for private settings, and the example that CDC used when they first introduced this guidance was they said, for example, in your own private home. They also very explicitly state in the guidance that this is not for healthcare settings. So CDC defines a healthcare setting as a nursing home, an assisted living, or an inpatient hospice, also hospitals, but talking about our membership, it's nursing homes, AL, and inpatient hospice. Other settings within our membership would be like the independent living in a life plan community, affordable housing, adult day, PACE programs, home health, that sort of thing. For those settings, you could follow this public health recommendations, the general public guidance, or you could follow the more conservative healthcare guidance. And CDC says that when you're trying to determine which type of guidance you want to follow for that setting, you need to evaluate the risks of the folks that you're serving in that setting. So in your independent living, you need to look at the residents who live in your independent living, the underlying medical conditions, the comorbidities, perhaps other risks, like if you have staff who are crossing lines between AL and IL, if your IL and AL share, or even with your nursing, share common areas and activity space, dining rooms, things like that. All of those things you want to take into consideration when you're evaluating the guidance that you're going to be following. Now, as I mentioned, this does not change travel recommendations. And so CDC still says that everyone should be avoiding non-essential travel, regardless of your vaccination status. If you do choose to travel, then you need to continue to follow the CDC guidance on quarantine. Like, for example, they recommend that you need to quarantine for 2 weeks. I believe it's 2 weeks after international travel, and any state requirements. And so a lot of states will have requirements that you either need to quarantine or be tested prior to arriving in the state. You might have to quarantine once you arrive in the state, or if you are returning to your home state after a visit out of state, you might be required to test or to quarantine. And you will still have to follow those requirements and recommendations, even if you are fully vaccinated. So then the next question is, how does this impact? Because we've been listening with our general public ears. So now that we put on our healthcare setting ears, how does this impact things like nursing home visitation? How does this impact testing requirements, things like that? As of right now, there are no changes to nursing home visitation. There are no changes to testing requirements. We do expect that CDC is going to put out some different guidance sometime soon that's going to be specific to long-term care settings. We also are expecting that CMS is putting out some visitation guidance. We know that CDC and CMS have been working together, and so whatever one puts out, the other one is going to be fairly consistent with. The testing piece of it, you'll remember that back with this public health guidance, they say, oh, you're exempt from testing after you are exposed if you're fully vaccinated. But your testing in the nursing home, testing in response to an outbreak, or testing as part of your routine staff testing according to county positivity rates, those are federal requirements, and they have not been changed by this CDC guidance. And so you are still required to follow those tests until further notice from CMS. And so, and at this point, we don't know if there will be any testing changes. And so those are just a couple of things to keep in mind when we're talking about what staff can do. Fully vaccinated staff can, because of this new guidance, they can have dinner with a friend from another household who has been fully vaccinated and has no at-risk people in the household. They can have dinner together without masks and social distancing in someone's private home. That's fine because they're off the clock, so they can follow that general guidance. But when they come back into your building and they're on the clock, they are still responsible. They still have to be tested for an outbreak, or they still have to be tested for your routine staff testing. So I hope that's clear. It's really, it's confusing sometimes to sort all of this out, and I'm happy to take any questions.
Thanks so much for being here, Jody. There's no questions in the chat as of yet, Dana.
Yeah, thank you, Jody. I guess the question that I don't want to put you on the spot, but as we continue this conversation, as residents are so eager to resume normal activities, I wondered if you had any recommendations or guidance for our members as we continue to walk this journey.
Yeah, it's really tough. I will say, because we've had a lot of conversations with CMS about visitation. With activities, of course, you are permitted to do activities. You have been permitted to do activities as long as your state has not restricted those. So you could do small, I think at least since May, you've been able to do small gatherings, small group activities, and communal dining. Of course, residents had to be social distanced and they had to wear masks. masks, and no residents who are on transmission-based precautions could attend those activities. But for those residents who were not, they could attend, and they could attend dining and things like that. But we know that was CMS's call on that. But because of outbreaks, because of community positivity rates that were then influencing outbreaks, we know that a lot of nursing homes were not able to have those activities and not able to do dining because there would be an outbreak. And then the state or local health department would say, no, you can't do your activities right now while you're doing outbreak testing or whatever the case may be. And so even though CMS has said this can happen, it does make it really challenging. And we haven't been able to do them up to this point as freely as the guidance would lead you to believe. But vaccination rates are on a really good path. And so, residents are doing great with vaccination and staff are picking up with vaccination. And we do expect that that's going to change activities. And in terms of visitation, as I said, we have had a lot of conversations with CMS. We have advocated both to CMS, to CDC, and to the White House Domestic Policy Council for changes in visitation guidance. CMS has acknowledged that the vaccination rates have really changed the way that they're looking at things. And so some of the restrictions that were put in place maybe don't make as much sense anymore. So some of the things that we've been advocating for would be that they would do away with the county positivity rate restriction on visitation. That currently, as it stands, you can't do indoor visitation if you have a high positivity rate in your county. So we've asked them to do away with that. When it comes to outbreaks, you can't have indoor visitation if you are in the midst of an outbreak, but we have asked that there could be a little wiggle room around that. Like maybe we have an outbreak, but it's contained to a single unit or it's contained to a single floor in the nursing home. So what about the other parts of the nursing home? Could they still continue visitation? We've also asked them to evaluate that outbreak in terms of testing as well. And could we potentially isolate outbreak testing to the unit on which the outbreak is occurring, at least initially, and then determine if it needs to be expanded. That is not a conversation that they have entertained with us thus far. The visitation, we've had a lot more conversation with. And as I said at the beginning, we do expect to see some new guidance coming out like any day now. I actually thought it was going to be today. I had this feeling like it's going to happen. Now I'm not feeling so positive about that, but we do really think there's going to be something coming out very, very soon.
Thank you, Jody. We really appreciate all the information that you gave us today. And I wanted to just point you to the chat box where we've included an article that Jody drafted about the CDC recommendations. It's very informative. So we have some time left. I wanted just to give another opportunity for questions in the chat box, or if you'd like to unmute.
Dana, I just wanted to point out there was a question of how can I get a copy of this recording after the webinar. We will include the link to the recording tomorrow in our COVID update.
Thanks, Melissa. Okay, well, we could move to the next slide. So not seeing any questions or comments, we will continue these discussions on our next call on March 17th. Hopefully, as Jody mentioned, we may have more guidance prior to that date. We have invited the Office of Licensure and Certification and the Department of Social Services to participate on our call for March 17th. So we hope that you'll join us as we continue. We don't have answers to all these questions yet, but we hope to be getting more, and our next calls will be focused on this issue. So wanted to give one last call to see if there are any questions for Jody. Okay. Well, we can go ahead and end our call. I want to thank everyone again for joining us today and look forward to talking with you again on March 17th. Thanks again, everyone.